Hi everyone, welcome to Forever Young with Dr. Kapoor. Today we'll talk about very interesting topic with Dr. Marjan. She is one of the world-renowned regenerative medicine specialists, internal medicine specialist working in longevity, our longevity clinic in Dubai. And this topic is regenerative medicine. It is very complex science, and I'm going to ask her to simplify it for me, for you, for everyone else along the way. Regenerative medicine, it all started that some harm has done. Now we have to somehow fix it. We have to regenerate it. And let's get to know more about it. Welcome, Dr. Marjan.
Thank you very much, Dr. Kapoor. Thank you for inviting me. Regenerative medicine, if we want to define it very simply, is a part of the medical science, actually, which are talking about repair, replace of any organ or any cells that is damaged. This can be happened through the cell therapy. It can be through the product of inside the cell, like exosomes, which is a product of the cells. It can be tissue engineering, which we use the cell on the scaffold and using that on some particular organ. It's very commonly used for the skin. And also we have gene therapy now in this domain.
Gene therapy.
So gene therapy is another part that's very promising, and there are a lot of studies on this now.
So you said really amazing thing. So it is about repair and of the organs. We know liver repairs itself, right?
Yeah. Yes.
But other organs don't able to repair it.
In the past, we didn't know. I mean, that's the medical doctors doesn't know that. A stem cell is, even in adult people, we have stem cells everywhere.
Yes.
And we have in our bloodstream, we have stem cells, in the organ we have stem cells, and which are able to produce the cell. And sometimes we don't need the production of the cells, we need the production of the other things like cytokines or the other substances that the cell produce, and these production of the cells can be helpful for the any problem that we have. I don't want to focus on only one organ. I'm talking as a general. So, for example, if we have a patient as a diabetic patient and we give the stem cell to the patient, it doesn't mean that the stem cell goes and straightforward going to pancreas and producing the insulin, which it is possible.
Yes, exactly.
It is possible, and now in
Canada
type 1,
we have done
with type 1
exactly.
diabetes, we do it now.
Yeah, we cured the disease,
yes.
diabetes forever.
Yes.
Yeah.
But it's not limited to
yes.
this. Besides this, once we give the stem cell to the patient, we together with the stem cell, we give a group of the pro-inflammatory cytokines. Pro-inflammatory means against the inflammation.
So pro-inflammation means something against inflammation. So inflammation is a reaction to something is wrong in your body, and your body is reacting to it. So inflammation like a swelling. You're happy when you get hit on your knee, it swells up, it's inflammation. So then you put anything against inflammation to make sure inflammation goes down. Right?
Yes, exactly. But this mostly is for controlling chronic systemic inflammation.
Chronic means whole body. Has it for long time, not just for one time and then you hit it.
Very shortly, I just explain what we have. The acute inflammation, like one that's we have, for example, we have a cut, we have redness, we have the whole inflammation and everything. These helping, which we call it acute inflammation. Acute inflammation is something that's for a short time and is in line with the health.
Yes.
We should have it. We have another kind of inflammation, which we call it chronic systemic inflammation. This inflammation starts, but it's not stopped. And this inflammation affect all the body, and it is a predisposing factor for the cardiovascular disease, for diabetes, for you name it. Everything is related to the chronic systemic inflammation. So once and it's a it's like a cycle. You have diabetes, you increase the chronic inflammation. You have chronic inflammation, it's increased the chance of having diabetes.
It's like a cycle,
like a vicious cycle.
So you have an inflammation in the whole body that leads to diabetes, and diabetes leads to more inflammation and more diabetes. And maybe that's why some people don't respond to medicines. And that's
exactly.
why sometimes they need more medicines to manage the diabetes.
Yes, exactly. Because we are not, all of us, we are not exact copy of each we are different.
Yeah, we're different. All of us, exactly.
The way that we react to the situation, even the way that we react to some level of the blood sugar is different. I'm sure that you saw people in elderly like 80s that telling you that I have diabetes since 40, and you can see that he or she is okay.
Yeah.
And also I had patients that at 40 coming with all the complication of diabetes in the first visit.
That's true.
So practically the response of us is different, and that can be, I'm not telling 100%, it can be due to different response to inflammation, different things that we have in our genome, different microbiome. So practically we are different, and once we give the stem cells to the patient, besides repairing the organ, we try to control these predisposing factor as well.
Exactly.
It's about the stem cells, but it's not limited to stem cells. We have exosome, which is the exosome is the product of the cells. That's
so exosome is a product of the stem cell.
Stem cells.
Exactly. So stem cell is one thing, and exosome is other thing. It's a very hot topic, and many people are researching it and see how we can inject exosomes that can help us slow down the aging process.
Yes.
Perhaps cure the systemic inflammation in the whole body.
Yeah.
Perhaps reverse the diseases such as diabetes and Alzheimer's and many different areas.
Yeah, there are lots of studies on the Alzheimer's disease and the Parkinson's disease with all these.
So how do exosomes work in theory?
Exosome can have different things inside it. Some of them have the mitochondria inside it.
Okay.
And we know that the mitochondria is the source of the producing the energy.
So mitochondria is your generator.
It's
a generator of that fire your cells.
Yes. And even sometimes cells, once a stem cell is beside for example, ischemic cell, to rescue these ischemic cells, transfer the mitochondria through the microchannel to the ischemic cell.
So simply, let me explain that to you what she's saying. Ischemic cell means there's a battery. Think of this way: there are two cars. One has a good battery, other car has a dead battery, and you're trying to start the car with a dead battery. It's not starting. There is some charge there, but is not enough dead yet. But you're trying to charge it, and if it's not able to charge it, you won't be able to start the car. So what you do is sometimes you bring the other car, a strong battery, then you boost the other battery, jump starting it. Now both cars can start.
Yes, exactly. This is the way that they are working. Same things is for the exosome, but depend on the exosome has what inside them. They can work differently. We can use them as a systemic IV injection, or we can do as a local for the aesthetic procedure for hair, for different things. And sometimes even I saw that some use it for controlling the pain locally in the some particular around the spine.
In the spine area, or the knee or the hip. So it does help people by injecting these exosomes.
They are different. That's if you go through the studies, you can see that we use the stem cell for the osteoarthritis. Intra-articular injection by injecting inside the joint, and exosome also sometimes work exactly same as the stem cells in the joint, and we even for erection dysfunction. the stem cell therapy is very, very effective. We had patients that are very, very happy with their response.
Yeah, I heard about that.
Yeah,
Exactly.
that's it.
So stem cells help many different ways.
Yes, it's that we cannot limit it to one area. It's it's a general thing. That's sometimes that's we have patients that's we did it for actually we did it for the hair. And the result come up that's the psoriasis controlled.
Oh,
They're
wow.
very, very severe, very, very bad psoriasis controlled.
Psoriasis was so bad
and
that you were using for hair,
yeah,
but he got or she got help. She got help from psoriasis.
Yeah,
that's so cool. That's amazing. I never heard that before.
The treatment was not done for psoriasis. We did it for the hair growing, but the result was that's the controlling psoriasis.
Well, this also is very important to know. So when you take any drug that can help you, can have opposite reaction. It could be a good reaction or a bad reaction. Thankfully, in this situation, she got the good reaction.
Yeah.
And she was able to eliminate this disease, or the disease could be controlled.
Actually, that's we had this in the back of our mind because for all the autoimmune diseases, giving the stem cell and the cell products control the inflammation, and the inflammation is the cause. So we expect it, but not in this range. That's getting completely treated, which was huge.
Wow. So tell me one thing. So when should people start consider using exosomes?
There is no exact time that I can tell to you because none of us are very similar to each other. I suggest that whoever that's thinking about it, visit a longevity doctor and somebody that's with the background of the regenerative medicine and decide case by case.
Case by case.
Yeah, it's not an exact time. For example, for the we are telling that everybody should have the mammogram on that age. We don't have such a thing for the cell therapy because it's very, very related to the person and it's very individual. So the best is that's the sitting with the patient, seeing them, they're looking for the how if they are in the risk of any disease or no, if they are not in the risk of any disease, if they have any issue, if they have any sign and symptom that they are in having the chronic inflammation. And once I'm talking about chronic inflammation, maybe you don't know that it can happen even because of the stress. Emotional stress can be one of the cause of the
exactly. So there's so many stresses that play a role: emotional, physical, body goes through it.
Exactly. So one, even 2% in one family, because they experience separate life, we cannot come with the one.
Exactly. Even the twin study, we saw that how epigenetic factors impact one twin, even though they are identical, but the other twin does not have the issue. So obviously, environment is more powerful than the genome itself.
Yeah.
And that's what's very important to visit longevity clinic, talk to our longevity doctors if you're thinking of using stem cells, exosomes, or peptide for longevity or other issues you may have in health side, knee pain, hip pain, back pain, men health, women health. So make sure to talk to Marjan and talk to other experts in the clinic who have amazing, vast experience and knowledge beyond my understanding, which I'm learning from them today, and this is an amazing.
Thank you.
So last thing I wanted to touch upon is there are a lot of supplements out there people discuss in longevity side. What's your opinion on NMN and other supplements in this area?
I think that's if the supplement we are for example, NMN is a very, very good thing. It's a study supporting this, and it's very good. But the point is that for any patient, I suggest that they go for the supplement that they are sure about
with the quality you don't know.
Yeah, because unfortunately we do not have a powerful authority that's control the supplements. I'm not talking about UAE. I'm talking globally. Yeah, there is not that kind of the evaluation and control that we have about the medicine, we don't have about the supplements. And so we have supplements that's, for example, very simple one, that's the fish oil. We have fish oil. We have patients that's taking fish oil that's have the pollution with the that's polluted with the HG, and so it's not.
So it's polluted. So
yeah,
it's not pure. So omega-3s are out in the market. They have contaminants inside.
They may. Yeah, I'm not telling all of them.
No, all of them. Some of them.
Yeah, some of them. So
knowing is important.
Yeah, it's very, very important. That it's not.
So how do people find out?
That's the point. They shouldn't go and Googling and telling that they're asking ChatGPT what's the supplement that I need to take, and go and take it from the pharmacy, because they should see doctor, and the doctor should provide them which kind of the supplement and which brand of the supplement they should go through. I had experience that's the patient taking the supplements that later on, once I saw the patient in a hospital coming with the Addison's crisis.
Addison crisis.
Yeah, and it was very strange for me. Once I sent the supplement that's bought online to my pharmacist to check this, they saw that there is the antibiotic, antifungal, and steroid inside.
In the supplement.
In the supplement.
Wow. So they hear it. So she's saying.
And it was a herbal supplement. That you are not expecting anything, and everybody was happy because of that. Yeah, it has it's like a gunshot to everything. Whatever that you had.
So knowing is very important. So.
First, don't buy online. Never buy online from the brands that you don't know it. I have a lot of experience about this kind of online fraud. And don't decide on your own. Go and check with a doctor.
Exactly. So talk to a doctor. So don't just take supplements because your friend told you, your mom told you, your dad told you. Make sure you talk to doctors, because they could have some chemicals, some things which may not react the right way for you. And if you're going to take any risk, make sure you talk to the doctors in Dubai Biolongevity Clinic. They can help you understand, and also make sure they're safe for you. Then you can use them in a safe manner. The last thing you want to do is that take a product, take a medication, and has a side effect. In fact, I had one patient, she had a hypophosphatemia, low phosphorus in her body, low potassium, suddenly healthy adult, no history. She went to hospital, they checked everything, nothing identified as a cause. What we found was she was using collagen replacement.
Oh.
And in collagen there was leucine, and there were other amino acids. And the way she was reacting, she ended up excreting all her minerals, and she was not able to even walk, and she was paralyzed. So they have to give her replacement, and she was able to discharge home after that. So not all supplements are safe, and knowing in which quantity is also important. They're like medicine. Your food is your medicine, supplements are medicine, your medicines are medicine. So make sure you take the right way. So I'm glad we have Dr. Marjan today. Help us answer these very complex science questions. Regenerative medicine is important, it's a cornerstone of longevity or overall health. And the stem cells have vast uses. We are using currently, there'll be more indications coming in. Exosomes are upcoming, huge potential in this science. Then we have peptides, there are many different areas. But make sure before you take, before you try, come and visit our Dubai clinic, and doctors will be glad to help you. Thank you so much for coming.
Thank you very much.
Really appreciate that. A lot of learning, and thank you so much for joining us, and looking forward to share more insights during our next episode. Thank you so much, Dr. Marjan.
Thank you. Thanks.
Thank you.